Okay, great. So we can start. So it's a pleasure to meet all of you. Today, I'm just going to be sharing a little bit about stress and burnout. Um, so before we start, I was hoping it could be a little bit more interactive. So maybe you can take some time uh, to just check in with yourself. Um, and maybe you can estimate, what's my stress level at the moment, what's my burnout level at the moment. And what was it that made me decide to come for this talk today? Like, what is my intention for the talk today? What do I want to get out of it? Is there something in my life or part of my life I would like to change or transform? So maybe you can take a few moments. If you feel inspired, you can maybe type something in the chat. Um, if you feel like it, if you don't, that's okay. You can just maybe reflect on it internally. And so as you're thinking about this, as you're reflecting on the intentions of the talk, I'd like you also to maybe think about your own experiences of stress or burnout. Maybe you can think about uh, recent experiences, times that you felt stressed or that you thought you might have been burnt out, or people that you think you might have been stressed or burnt out from work. Um, some of you have been really kind and you've kind of shared some of your own intentions and things that you want to learn today. So things like how we handle stress, at what point it feels like it's too much. So we will certainly be covering some of these. So thank you for sharing some of these intentions. Um, and sometimes that can come with anxiety as well. So when you share, do share only as much as feels safe for you as well. Um, um, and how do we prevent ourselves from burning out? Maybe after the first time that we've started burning out. So I really appreciate some of that sharing. It's something I'm going to keep in my mind as we go through the talk. And if it's not answered, please bring it up as well. Um, so as you're reflecting on these personal experiences of stress and burnout, maybe this is something that we can hold in your mind and think about how it applies as we go through the content of the talk today. So some of the things that I've planned to cover are, what are some of the signs that you're burning out, understanding what is stress, what is burnout, um, understanding a little bit about what how burnout leads to changes in the way that we behave, um, and the way that we receive or respond to stress when we're kind of in a burnt out state. At what point it might make sense to ask for help or look for help, different ways of self-caring, and then we'll go into an exercise called the self-compassionate break. Um, so that's kind of what we'll cover today, and then we'll leave some time for question and answer as well. So maybe we can start by maybe thinking about what are some of the signs that someone is burning out. And so we'll start with the definition of burnout. So burnout is defined as a syndrome related to workplace stress, primarily. And so it's conceptualized as a syndrome that comes about when there's chronic workplace stress that is not so-called not been successfully managed. And it's characterized by emotional depletion or exhaustion, a feeling of distancing from your job. So feeling like maybe you don't want to be in a job, developing some avoidance. And that can come with cognitive distancing, such as cynicism or depersonalization. So depersonalization is feeling not engaged with your work, not feeling like you are yourself when you're there, and sometimes even feeling like you're you're somewhere else or even out of your body. Um, and then feeling ineffective, becoming less efficient. Um, uh, and so that's kind of a vicious cycle because as you get worse at doing your job, that results in increasing stress. So here are some of the signs of and symptoms of burnout can be divided into the physical, emotional, and behavioral signs and symptoms. So physical signs of burnout include things like feeling tired and drained most of the time, uh, lowered immunity, getting sick a lot, getting what we call somatic symptoms, things like headaches, back pains, muscle aches, and change in your appetite that can either be overeating or eating too little or not having any appetite, and a change in sleep habits as well. So for some people, that may be insomnia, finding it really hard to fall asleep, finding it really hard, and that was kind of mentioned by some people earlier, finding waking up in the middle of the night or waking up really early, or sometimes it can be not wanting to go to work and just staying in or feeling so tired that you're in bed the whole day. Emotional signs and symptoms include changes in the way that we see ourselves, as well as changes in the way that we feel in response to different things. So, an example might be feeling like a failure, having a sense of self doubt, feeling helpless, trapped, defeated, feeling alone, losing motivation, having a negative outlook, and also not being satisfied. Um, And then behaviorally, uh, the way that we respond to burnout can be things like withdrawing from responsibilities, social isolation, procrastination, um, uh, avoidant behaviors, or things that help us to using behaviors that are not healthy for us, but make us kind of get ourselves knocked out or get distracted. So things like using food or drugs or alcohol in an unhealthy way. Um, uh, uh, Often behaviorally, people who are burnt out will become more irritable. And so take out frustrations on other people. So for example, if you can't scream back at your boss, maybe you end up screaming or shouting or becoming irritable at home. Um, Perhaps not by choice, but just because that frustration is kind of built up inside of yourself. Um, and also doing things that kind of reduce your exposure. So things like coming in late, leaving early. Um, so what's the difference between stress and burnout? Now, the first thing is that this is a continuum. Um, there may not always be a very clear line that says, oh, I'm definitely burnt out or I'm definitely stressed. Um, but we tend to think of stress as an initial response or initial reaction, rather than something that then kind of the chronic phase of stress that comes with burnout. So with stress, you tend to see someone who's very stressed tends to be overengaged. They're overreactive emotions. There's a sense of urgency, hyperactivity, um, but also associated with less energy. Um, so and it may be associated with things like anxiety. And here the effects tend to be more the physical effects. And then as you uh, have chronic stress over time, body kind of starts to shut down. So, and the mind starts to shut down. So there's disengagement, um, distancing or bluntedness of emotions, a sense of helplessness, loss of motivation, starting to feel depressed and having uh, more emotional damage. Now, some of these are, now when someone experiences stress or burnout, they probably won't experience all of them. They may experience some or a proportion of these. So these are all not conclusive in of themselves. Um, uh, then within the stages of burnout, like we mentioned earlier, it may have initial stress. It may then lead to behaviors that kind of conserve energy, so some slightly avoidant behaviors, and then being completely exhausted. So this is an example of one of the ways that burnout has been conceptualized. So what is stress? Stress can be understood in many ways. There are many definitions of stress, but one of the definitions that's commonly used in the scientific literature is the perception of a threat. And threat has a very broad category. For an animal, that would be often like a predator or lack of food. But for humans, it is anything which suggests that it may threaten our sense of stability or our ease. So it can be problems at work, it can be problems in a relationship, and the resulting emotions that come with it, the discomfort, emotional tension, anxiety, or sometimes the difficulty with the adjusting to that threat can all be examples of stress. Another example of stress is taken from the perspective of what we call homeostasis, which I'll explain later, which is when the demands exceed the personal and social resources that the individual is able to mobilize. So when it's too much for you in some way. Um, so a stressor can be understood in these scientific terms as a stimulus that threatens homeostasis. So anything that requires that exerts demands on our personal and social resources that may require some kind of adaptation. So I hope I haven't lost you with some of these scientific terms. So there's that initial stressor, which is that stimulus that or threat that we experience. And then there's our response or our reactivity to that stress. And we call this stress reactivity. Um, and someone's stress reactivity is their capacity or tendency to respond to a stressor. It also refers to the individual disposition that someone may have in response to a stressor, and the various vulnerability factors that affect the way we respond to stressors. So the way that we think about stress reactivity in the scientific literature can be that when we respond to an initial stress, that's our stressor one, um, there may be an initial rise in our negative affect or negative thoughts in response to that stress. So PC is persistent cognitions, NA is negative affect. And so there's an initial increase in this kind of negative emotions and negative thoughts. And we call this initial response the reactivity, the initial increase. And for different people, it may peak at different rates and it may rise at different rates as well. And then after that initial peak, there's a recovery. That's the extent to which these negative emotions or thoughts will continue to persist. And for some people, it may be faster. For some people, it may be slower. And it may come all the way down back to baseline, or it may come part way down. And then what happens after someone has had initial stress is in times of chronic stress or recurrent stress, there is this phenomenon called pile-up, that when there's repetitions of the stress response, when there's a second stressor or a third, fourth, fifth, 10th stressor, the reactivity or the initial stress response may not be as much, or it may be a little bit slower, or maybe somewhat different. And then the recovery phase also changes as well. That recovery may not be quite as fast. And so this this is kind of an example or an understanding of the different ways that we may think about or measure stress reactivity from a scientific perspective. And so we think about this reactivity or this response as a reaction that the organism uses to regain what we call homeostasis, which is that equilibrium or set point. And that response biologically involves the release of what are called stress hormones, which are things like cortisol. It can include things like the fight or flight response. So the release of adrenaline, increase in heart rate that may come with that. So that can be in response to anything that changes our physiology. So it can even be things like exercise, for example, from a biological perspective. And then what happens when we have these recurrent stresses, as we kind of discussed before, is that there can be a change in that set point. So initially our set point may be at this level, and we always come back to that level of relaxation. But when we have recurrent stresses, that set point may change. And this is what's called physiological dysregulation or an allostatic load. And it arises when there's these recurrent stressors or chronic stressors, and it can result in wear and tear on one's body. It can result in changes in one's coping mechanisms, so development of some of these unhealthy behaviors. It can result in biological changes that can then result in what we call secondary outcomes like high blood pressure, high cholesterol, or mental health problems like depression and anxiety, and then longer term health consequences as well. So this dysregulation of these allostatic responses or allostatic overload can relate to chronic stress and disease. This is some of the biology behind it. I won't go into detail into this except to say that it involves hormones, which are both the stress hormones as well as the fight or flight hormones. It involves the brain as well. So the brain has a system as well that is involved in regulating this and regulating these what we call hormonal or neuroendocrine responses. It involves the body as well. So things like your heart, your blood vessels, um, as well as your inflammatory responses, your immune system as well. So what are the kinds of things that influence the nature of our stress response and the type of stresses that may affect one individual more than another, or your personal profile of kind of vulnerability to stresses? Um, so this is an example of a model for stress and how it relates to these longer term effects. Um, in this model, you have uh, background factors or contextual factors that includes, for example, your genetics, your early life experiences, um, your socioeconomic background, your cultural background, so the kind of social factors, um, your life experiences, things like a history of trauma or a history of chronic stress, as well as recent stressors, things that may be happening right now in your life or that may have happened recently and are still affecting you. And then there are protective factors, your social supports, your psychological resilience, healthy behaviors or healthy responses. And all of these factors come together um, and influence uh, us both in terms of our physiology, that's the allostatic states, as well as our mental processes or psychological responses. So psychological responses include cognitive responses, like how we see ourselves, how we see the stressors, um, the kinds of thoughts that come into our mind as a result of that, things like worrying, or which is thinking about unconstructive thinking about what may happen in the future, or rumination, thinking about bad things that happened in the past and kind of ruminating or mulling it over in our minds. Things like anticipation, reactivity, recovery, and habituation, and how it affects our physiological responses. So these in turn affect the body as we described earlier and can then lead to kind of the biological effects. So what are some of the factors that may predispose to burnout? So the factors in at work, things like a sense of lack of control. So maybe before we continue, I've covered quite a lot, and there's been quite a lot of content. I just want to check: is anyone lost at this point? Does anyone need any clarification about that? No? If not, I'll continue. And we'll talk about some of the factors that uh, we think may predispose to burnout. So at work, some of the things are a sense that you're not in control. That can either be because you're finding it really hard to adjust, you're overwhelmed by the workload, you have a boss that doesn't give you a lot of autonomy, or you have a work environment. For example, it's been found that one of the more stressful examples of work would be shift work, where you have to work at a certain pace because that's the pace that the things that you need to do are coming in. So you don't have control or say, or you can't do things at your own pace, you do things at that pace and you do things at under certain hours. Um, Unclear job expectations. So feeling like you don't know what to do, and when you've done it, you don't know if you've done enough or not. Um, so the lack of clear job expectations, dysfunctional workplace dynamics. So that can include things like power dynamics, not feeling safe in your current work environment, or conflicts at work with people. Um, and then there are lifestyle related factors related to burnout. So uh, often if there's not enough time to relax and socialize, not enough time to recover back to that set point, that leads to a chronic state of stress, a lack of social support, or when there's a lack of balance between work and the rest of your life. And then there are personal attributes. So one of the early findings related to burnout and workplace stress was this study very early on by this cardiologist who found that His patients who were getting heart attacks were all these like middle-aged to elderly CEOs. Um, and they would come in and they have kind of unrelenting standards. They push themselves, they push the people around them. They're quite perfectionist. Uh, and these guys were coming in with heart attacks earlier than kind of other people. Um, and he coined this term type A personality. And these type A personality describe some of these personal attributes actually. So like I mentioned, perfectionist unrealistic standards, also high need for control, reluctance to delegate, um, a tendency to get frustrated, and a pessimistic view of self and the world. So these are some personalities that can be associated with burnout, but they can also result from burnout or can result from some of these things or difficult experiences. So even if, let's say, you're someone that may have some of these attributes, which can also be double-edged swords, try not to be so hard on yourself for having them, but also understand what is their impact on yourself. Um, so the other important thing is that when someone is in a state of burnout, they may start to occupy what's called the sick role. So that may mean that they may start to see themselves as not being so capable, not being able to work, um, and um, when there are other people that are stressful that they encounter, they may respond to them in ways that may be different from the way we might usually respond. So maybe when before we were burnt out or before we were stressed or before we had other things going on in our lives, if we had a boss that was unreasonable, um, we might make a joke out of it, or we might take some perspective, might take a step back, but still do our work to the best of our ability, and try and not let it affect you. But when someone is in a state of burnout, maybe when the same stressor occurs, uh, it might feel a lot more overwhelming. It might lead to a more avoidant response. Um, and it may lead to more self-destructive behaviors as well. So that's what we call the countertransference that's associated with that. Um, And so we have had some input as well, actually, which is quite relevant to some of these things. So a lot of you actually probably already have some clear ideas about these. So on an organizational level, what are some of the things that can contribute to burnout? Let's say you are an organization and you don't want your team to burn out, or you don't want your workplace to burn out, or you want your workers to be more resilient. These are some of the factors on a workplace level that might be important. So paying attention to things like values, the extent to which your organization values may lead to conflicts in an individual. You can ask yourself as well as a worker, to what extent are your own values in conflict with the organization's values? So if you feel conflicted, if you feel distressed by that conflict, that can sometimes lead to burnout. The level of workload, whether that's too much or not being properly equipped or skilled to do what you're being assigned to do, a sense of inequity in pay, um, unfairness in evaluation or the opportunities that are being offered to you, um, a lack of control that we talked about, lack of autonomy or not being given say or control over what it is you want to do. Um, Support at work or relationships at work, things like a lack of positive connection, conflicts that have not been left resolved, and finally, financial. So if there are financial stresses that you have, and you're not getting enough compensation, or if you feel that the financial reward is not uh, appropriate, that can be. Um, Someone brought up also the role of caregiver stress, and yes, burnout is very common in caregivers as well, um, and there are unique stresses associated with that as well. Um, and caregivers also are in a situation where you're often more alone and it's harder to seek support as well. So caregiver burnout is very common as well. That's important to address as well. Um, so we'll talk about coping strategies as well. So at what point um, is it appropriate to seek help? And so this was a question that someone had asked earlier as well. What's the breaking point? Or when do we seek help and how do we seek help as well? So what I'd like you to do is maybe take a moment and just reflect back yourself. When do you think you have needed help? How do you tend to ask for help? What are the barriers you would have to asking for help? Um, uh, Personally. Um, so my personal opinion is that it's probably never too late to seek for help. Um, there's uh, it even before burning out or even before encountering stress, it can sometimes be helpful to preempt and put in place or seek out social support uh, in a healthy way or in an appropriate way. So knowing who to trust, how to trust them, how to engage their help, knowing what they're able to offer can be really helpful. And that's at all stages, I feel. Um, when do we seek professional help? That's, I think, often a personal judgment call. Um, uh, Clinically, most of the time, for example, from a psychiatric point of view, we don't have burnout is not a state where we have a lot of evidence about whether medication, for example, works or whether the conventional evidence-based therapies work. Although we think there's increasing evidence that it does help in burnout as well. Um, so the point in which you might, for example, have a clinical syndrome that might benefit from treatments like medication and evidence-based treatments can include things like clinical depression, among other things. So clinical depression, for example, includes prolonged low mood almost every day. Usually we say for at least 2 weeks or more. When that's associated with a loss of interest in pleasurable activities, when the things that used to be interesting or fun or pleasurable no longer feel that way. When the individual feels worthless or guilty um, beyond what is appropriate, when there's withdrawal from social activities, when there's frequent feelings of fatigue or loss of energy, significant weight loss, usually we say about 3 kg or more, or gain or change in appetite, a loss of concentration, um, insomnia, hypersomnia. Often we see early morning awakening as well, so usually waking up early. Uh, and when there's suicidal thoughts or thoughts of death, or even suicidal attempts. So often when someone has several of these symptoms, usually we say 5 or more, and usually the first two, one of the first two, then we would suggest that that's indicative of clinical depression. But I think it's fine to seek help much earlier than that. In fact, it's probably beneficial to seek help much earlier than that. But this is the point at which we would say, well, there's quite a lot of evidence that, for example, medications like antidepressants might be helpful or work. Um, what's the relationship between stress and depression? Um, is a model that I've kind of adapted and that I tend to use in my research, which is underlying biological and psychological risk factors. So things like a history of difficult developmental history or history of difficult experiences together with biological risk that leads to psychological vulnerability and physiological vulnerability that we talk quite a lot about. That vulnerability interacts with the experiences of stresses that can be daily hassles as well as life events that leads to these changes in our neurobiology um, um, that then lead to depression. So usually at this point, I would encourage people to share some strategies that you've had yourself for self-care. So if you don't mind, maybe take a few moments first, reflect on how you tend to take care of yourself or what you would like to do to take care of yourself. And think through what has been effective, what has been not so effective, what tends to work quite well for you personally, what are some of the different ways that you tend to care for yourself? Um, and then if you feel able to, try to share with the rest as well about uh, some strategies that you've used that may or may not be helpful. Maybe so that we can, because I think I'm certainly not an expert in self-care or burnout or stress. I feel that there's probably collective wisdom among us. And so if any of you are able to share some of your own strategies for self-care, that'd be great. So someone said, do something I like every day, um, like watching a movie to make yourself happy. That's nice. Exercising, consuming things that you like, connecting socially, going for walks, listening to music, knowing when to take a break. So listening to yourself is really important. So that's really good. Listening to yourself and what you need, and paying attention to that. Giving yourself some time alone to do things that you like. Um, Meditation, gratitude, journaling, um, eating nice food, watching TV at night. When we think about self-care, we also think about how it relates to our routine, um, pets as well. Now, some of you may find this easier, some of you may find this harder. And there may be constraints in your life and schedule. So often, I think, for example, someone mentioned about caregiving, the requirements or the workload or the things that you need to do sometimes are quite set, and it may be difficult to find that time or to set aside that time. But I think even a few moments or even a few seconds to take a breath can also count as self-care. Even doing the same stressful thing in a different way that's slightly kinder with yourself uh, can be um, can be an example of self-care as well. Some people talked about vacation, which yes, that can be hard right now with COVID, and I think especially now when we're isolated, some of these things um, that we need. But I think also just setting an intention to take care of yourself where possible uh, may give you a chance to maybe be creative or find creative strategies to self-care. So it's wonderful. I feel like you guys have come up with a lot of strategies that maybe are really, really helpful. I agree. Saying no is self-care as well. These are some strategies that you may be able to find online. Um, so things like listening to warning signs. So the first thing is really listening to yourself, I feel. So some of these signs and symptoms that we talked about earlier, these are example of warning signs. Paying attention to them and knowing that they may show that you need more self-care, or you may need to make some kind of change in your life. That's the first thing. Recognizing or being alerted to the importance of self-care. Um, and then another way is to try and take control. So that can be in the form of time management, evaluating, like some people said, saying no and prioritizing tasks, and doing the things that are higher priority or more important, or that may lead to greater stress. We talked about self-care. The first step of self-care probably is meeting basic needs. So, we will talk about the Maslow hierarchy of needs, starting with really basic needs like eating on a regular basis in a healthy way, sleep hygiene, then things like hobbies, relationships, and then things that give you a sense of meaning. Social support, setting boundaries is really important, knowing what it is that you're capable of doing, what it is that's healthy and appropriate, and then being very clear about that, setting those boundaries for yourself and setting those boundaries with people that may lead to stress or create demands for yourself. So part of that setting boundaries can be things like clarifying job description, asking for new duties if the current duties are too stressful, and also seeking help. Um, so here are examples of different ways that different aspects of our life may be addressed therapeutically. So therapeutic interventions or protective factors that may help address them. So for example, a risk factor may be poor executive function, or less self-efficiency, or negative a tendency to focus on negative things. And the things that may often help therapeutically are things like learning how to reappraise. Reappraise means to reframe the same thing. So, for example, if we see something in a really negative way and it makes us feel really overwhelmed and bad about ourselves, thinking about it in another way, like maybe it's okay, maybe other people find this difficult too, or thinking maybe this is only temporary or isn't going to last. Um, uh, or developing coping skills with that. Um, so some protective factors against that might involve developing optimism, developing cognitive flexibility, um, developing self-efficacy. Um, Another example of a risk factor may be emotion regulation, the tendency to experience really strong emotions like anxiety or frustration, or sadness or anger, or feeling helpless. And things that tend to help with emotion regulation include things like mindfulness, which we will go into, um, emotion regulation. Um, we use in DBT, use, for example, what we call tip strategies, which involve changing physiology. So either using a distractor or changing the temperature or intense exercise, which we'll talk about as well. Um, Using a stress ball or music. Um, Social risk factors include uh, social isolation, or not having healthy people in your life, or having social stresses, people that are stressful in our lives. And um, that can involve developing more social skills, making friends with people that are more supportive, managing these relationships that might be stressful in a more active way. Um, um, and sometimes that involves saying no or limiting the nature of those relationships. Um, and then physically, um, things like sleep deprivation or poor cardiovascular fitness can be addressed with better sleep habits, good nutrition, physical fitness. Um, and these in turn can influence our neurobiology. So there's some really great suggestions here. So I do feel like even in the course of this lecture, there's a bit of a community here that we are offering each other things. And some of these questions that we may put out there, they may take a while to be answered or they may not be answered yet, but we may, by putting them out, kind of other people can learn from them and we also have a chance to think about them ourselves. I'm going to talk about some of the more formal therapeutic ways that we may address stress. One form of therapy that I find is helpful with some of these things like psychological flexibility is a form of therapy called acceptance and commitment therapy. And I'm not a specialist in this form of therapy, although I may use some of the skills sometimes. Um, and so in acceptance and commitment therapy, there's a focus on psychological flexibility. And that includes things like being willing to experience difficult thoughts, being able to be with those thoughts, being present in the here and now, um, understanding what our values are, um, understanding what is truly, truly important for us, and then taking action to pursue those important things. So that's the kind of commitment part. So um, so the acceptance part involves kind of acceptance, being present, and also observing the thoughts without being controlled by them. Um, and then the commitment part involves identifying our values and committing to taking action to pursuing those things and seeing ourselves as not necessarily being um, affected by time or experience, but rather being kind of a part of a context. Um, so some of the ways that we may do this, let's start with the values part of the acceptance and commitment therapy and getting in touch with what our values are. Our values can be different in different contexts. So what we can do is think about ourselves in these different contexts, and think about what is our value, what do we want from those different contexts, uh, and you can choose one or you can gradually move through a few of these. Um, and what is it that we value? What is it that we want in those contexts that or that we want to be different? and what is a single action that we might take right now that might help us to move closer to that value. So it could be, for example, in our family, what kind of relationships do we want? Or it could be a value of what kind of person we want to be, like what kind of, for me, like what kind of husband or what kind of father do I want to be? So that can be in a marriage. What is the quality of the relationship that I want? What kind of parent do I want? Physically, how do I want to look after myself? What is the kind of community that I want to be a part of, and how do I want to contribute to that community? What kind of friendships do I want? Um, how do I want to act towards my friends? Uh, what kind of work is valuable to me? What are my qualities or values as an employee? Um, what is important to me to enjoy? So take some time, think about our values, and think about how it connects with the way that we live our lives. And that's important, especially when someone is in a state of burnout, um, because when you're in a state of burnout, often there's a disconnect or a detachment from our values. There's an engagement that has come about because that's the nature of the symptom of burnout. That the body tends to shut down as a defense or protective mechanism. And if we want to combat that burnout, we need to find a way of getting back and engaging with our values in a way that's healthy and rewarding. The danger is that we try and engage, we push ourselves to engage without that value and without doing it in a way that gives us value and gives us motivation. And it causes us to go deeper into the burnout because we're pushing ourselves without getting anything back. So it's really important when we take action, when we do things, we do it in a way that gives us back a sense of value as well. Okay, so I'm going to talk a little bit about empathic distress and how empathy or empathic distress differs from compassion. Um, and the reason that I'm going to talk about this is I'm going to start to move into um, an idea of what, just checking on the time. Okay, we're running slightly late on time. So I'm going to go a little bit into mindful self-compassion. And before I go into that, I want you to think about what's the difference between empathy that causes us distress and compassion. And I think this is especially helpful for someone that is in a helper role. So for myself at work, I find this distinction really helpful myself. Um, and I think for caregivers, this is really helpful, maybe parents. Um, but certainly even someone that is in a work environment or or that's encountering things or seeing things that may be emotionally distressing or stressful. So the first difference is that although in empathic distress and compassion, both cases there's a recognition of suffering in the other, um, there is not only what we call emotional contagion or emotional resonance in compassion, but also a cognitive understanding of that situation that that gives you a sense of control or allows you to have a sense of distance as well as that deep understanding. Um, Often in empathic distress, there's more of the contagion. So there's emotional empathy or unconscious affective resonance. Whereas in compassion, there's a sense of both that unconscious resonance or empathy, but also a sense of the conscious decision about how we want to address it or processing of that emotion. Um, in empathic distress, there's a sense of fusion, feeling almost the same as that person. Whereas in compassion, you see yourself, you see the other person, you see yourself, and you see yourself with that person or in relation to that person, and you see all three of those things. Um, so with compassion, there is a greater sense, like that cognitive side is the awareness, and there's an ability to distance yourself. Distancing doesn't mean necessarily not caring or not being concerned, but being able to bring wisdom into that interaction, knowing what is appropriate, what is a healthy boundary, knowing what is effective and helpful, um, uh, both on emotional level, on internal level, as well as on external level. Um, and In the attachment literature, we talk about mentalization, that when a baby, for example, is crying because they're distressed, uh, um, a healthy response from the mother is what we call mirroring. That means that it's not feeling pure distress from the child's tantrum and then being stuck and helpless with it, but instead having some of that emotion, having a understanding of the child, an understanding of the emotion, and understanding of what they need, and then using that in order to respond appropriately in a way that makes the infant feel understood and meets their needs. So it's a similar thing in compassion, that there's a reactive resonance, there's an understanding, but there's a mirroring aspect to that that comes with a cognitive understanding and wisdom. Um, and by doing that, when we use compassion in that way, we're able to sit with very painful emotions, very difficult emotions, both in ourselves and in other people, without being as disturbed, without being triggered in terms of our past traumas or past difficult experiences, uh, without developing that similar distress. Uh, and by not having as much of that kind of response, we reduce the risk of emotional exhaustion and burnout. Okay, so in order to make use of that, I'm going to talk about, we're going to do an exercise in mindful self-compassion. Um, so mindful self-compassion is compassion directed inwards. Um, Often, for many of us, we find it easier to be compassionate towards others than we do to be compassionate towards ourselves. Often, we tend to have a different standard for ourselves as compared with others. Um, uh, and and so this is an attempt to help us to develop more of that compassion, more of that kindness or gentleness as we go through our day, as we encounter distressing experiences, how to develop courage and compassion and self-care in the way that we respond to these um, experiences or stresses. So there are three key elements. Um, I'm going to start with the last one. The first element is awareness of that present experience with acceptance. So awareness of that suffering, that's mindfulness. Uh, the second is a sense of common humanity, that we're not alone in our imperfection, that there's something there which connects us. There's something in that suffering which is part of living, that's part of being human, that connects us with the rest of humanity. And then the third element um, that we that we tend to use in mindful self-compassion is kindness. So a kind attitude towards ourselves, a sense of nurturing and soothing, a desire for ourselves to be well and to suffer less, and acknowledging those problems without judgment. Now, the goal of mindful self-compassion is not necessarily to make ourselves feel less suffering. Um, it may sound paradoxical, but that's more of a side effect actually in mindful self-compassion. The aim of mindful self-compassion is to change the way that we relate to that experience of suffering, to relate to that experience of suffering in ourselves, or difficulty, or that thing in ourselves that we may not like very much, in a way that is a little kinder, a little more gentle, a little bit more compassionate. Okay, so some myths that come with with self-compassion is it something that is selfish or self-indulgent or permissive? If I am self-compassionate, does that mean that I've used up the compassion on myself, and I don't have compassion left for other people? Does it mean that I will be too focused on myself or allow myself to get away with things which I shouldn't be allowing myself to get away with? And I would say that that is probably not the way that you have to use self-compassion. That often when someone has more compassion for themselves, that gentleness for themselves, they are able to apply it and bring that quality to their social interactions in a way that allows them to be more selfless while taking care of themselves. Um, that when you use self-compassion and you truly understand your difficulties, you truly understand what makes it hard, you empower yourself with that acceptance of where you're at right now, to be able to change that and to do something which is more compassionate or which does better for yourself. And so by being more self-compassionate, there's less fear of failure, there's more motivation, and there's also more compassion, care, and concern for other people. So with that, we're going to stop sharing for a moment, and we're gonna do what's called the self-compassion break or the compassionate break. So I want you to maybe take a few moments, and I'm going to turn off my sharing, um, and uh, and I want you to maybe just find a comfortable posture first, and that posture can be um, maybe in your chair, um, maybe give yourself a little bit of a shake, bit of a rub. You can stretch yourself a little bit as well. Um, And as with this talk, I want you to maybe just set a little bit of an intention that the focus here in the self-compassionate break is to try and find your calm center in times of distress. And so take a few moments to be by yourself, um, adopt a comfortable posture, uh, give yourself a chance to come back to the moment, bring yourself back into the body. Had a lot of theories so far. We've had a lot of um, thinking, a lot of um, sharing. Give yourself a moment to quieten down and give yourself a moment to listen to 3 sounds of the bell. Just breathe with the bell, enjoy the sound, listen, and come back to yourself. As you come into stillness, take a nice, deep breath. Slow. Feeling the sensations of the breath as you exhale. Let it resume its natural rhythm. Feel this body breathing. Take some moments to scan in your life. Scan through your life, and maybe you might notice some moments in your relationship with others, some moments at work or at home that you may have turned on yourself in some way. Bring to mind a situation or that a moment recently that's caused you some distress. And I want to emphasize some, so don't bring up something that's traumatic or very painful or very hard to accept, but something that causes you a little bit of stress or some stress. Um, and call the situation to mind. So as you call the situation to mind, think about what's actually going on, who said what. Really bring that situation to life in your mind's eye. See if you can actually feel the stress and emotional discomfort in your body. try and just pay attention to that sensation in your body, that situation of stress. And the first step is bringing mindful awareness to the fact that suffering is present. This is a moment of suffering. So this is the first phrase. Maybe saying to yourself, this is a moment of suffering. Just recognizing the stress that you're experiencing with that moment that you're bringing to mind. And the idea here is to bring a sense of acceptance and mindful awareness that suffering is present. Some people, and I encourage you to find your own phrase here, but anything that allows yourself to fully acknowledge, validate, and accept that sense of suffering in yourself with this. So another example of the phrase might be ouch, or this hurts, or this is stressful, or I'm struggling. Anything that describes and really helps you to see and accept that experience. Now, the second phrase is meant to help us to normalize that experience. So the second phrase is suffering is a part of life, or a part of living. Whatever we're experiencing in this moment, whatever suffering that we feel, it's really part of what makes us human. It's part of what connects us to every other person in the world. That there's not a single person in this world that does not experience some suffering of some kind. And there are many people in the world that may experience something similar to what we experience. So even now, I'm not alone. We all struggle in our lives, and it's normal to feel this way. It's natural to feel this. There's not anything wrong with us um, for feeling this way or suffering this way. And this is again, but to help us to normalize that experience, to bring acceptance to whatever it is that we are connecting with. Take some moments to sit with this, connect with this. Connect with the sense that we're suffering together with people in this room or in this Zoom call. And the third phrase is to help us to offer ourselves some compassion or soothing. So the third phrase is, may I be kind to myself. Maybe in this moment, what you can do is you can perhaps take your hand, place it over your chest, or just pay attention wherever you had noticed that emotion or that feeling of suffering in yourself. Maybe you can place your hand over, maybe over your back. For me, here, here. Um, and through that hand, feel that warmth and offer yourself maybe some of that warmth, some of that soothing, that gentle soothing. And the phrase is, may I be kind to myself. Feeling the warmth of your hands, the gentle touch. Let that feeling of care stream through your fingers deep to your brain. Now, some of us may find this hard to do, to bring up that feeling of care for ourselves. And if you do, one thing that may help is to imagine this person that's suffering, or this thing that's suffering, is bring to mind an image of something that you care for in an uncomplicated way. Maybe a small animal, like a little kitten, maybe a baby, um, maybe someone that you have a lot of care and naturally a lot of kindness for. And imagine, or maybe yourself as a small child. So whatever helps you to bring up that sense of care and kindness, imagine that person deep in you, and that you're offering that care and kindness to them. Maybe phrases like, "I'm here for you," "I care for you," "You're not alone." Take a few moments to sit with that kindness and care. And it may be soothing, or it may not, and that's okay. The focus is on trying to generate that sense of care for yourself, that desire to be gentle and kind to yourself. If you continue to feel that it's difficult to generate that kindness, maybe you can ask yourself, what is it that I need to hear right now to express kindness to myself? It may be things like, may I give myself the compassion that I need? May I learn to accept myself as I am? May I forgive myself or be patient with myself? Whatever it is that you need to overcome some of those barriers to being kind to yourself. And also being gentle and patient with whatever process you may be going through at that moment, whatever it is that you may be through. Then you can take a moment to bring yourself back to the present moment, back to yourself, the sensations of your breath from your body. And if you're ready, gently open your eyes. If you enjoy, three sounds of the breath.